Hello friends, in this video we're going to discuss about premier hair transplant surgery. Surgery which follows the best protocols on earth and the latest protocols. The surgery which creates great hairline, premier hairline, dense hair transplant, undeductible hair transplant, very safe hair transplant and long lasting hair transplant. So these kind hair transplant with correct angles, direction, soft hair, curls and whatnot. Okay, and with the comfort and with the right facility and with the right safety protocols and experts in place. So to get all these, what should be the cost that we are going to discuss? Key how to get a premium hair transplant, and of course with the right cost. Don't think expensive means premium. Don't think that. Neither you should go for low cost and compromise the quality and the safety. So because truth is always not black and white, it's gray, somewhere in between. So what we are saying is a lot of people are wasting money thinking that expensive was the best. No, it's not. It was not that easy. Just price your product so high and it becomes good. I'm sorry, it's not like that. You have to research. Similarly, if you go for a low cost, very high chances of getting a unsafe hair transplant, detectable hair transplant, poor hairline design, and if you put 1,000 hair grafts, maybe 500 come. If you put 5,000 hair grafts, maybe 2,000 come. See the number 5, 6, 7,000 hair grafts looks impressive, but if you put 5, 6, 7, 8,000 hair grafts, how many come out? How many grow? That's important. It's not somebody says to you 5,000, 6,000, 7,000 hair grafts. No, no, no. In fact, we should go slowly. Why one should take too much risk in putting too many grafts together? Put X number of grafts, wait for 6 months. See the results, me or anybody else, see the results, how it's happening. Okay? Once your scalp has taken up well, once the doctors and the technician did a great job, then you can go for the next. Why? See, anybody, your scalp can be wrong sometime. Your seed, the hair follicles may not be good sometime. Your genetics may be bad sometime. Maybe the doctor was not good sometime. The technicians were not good sometime. Anything can go wrong. So one should not try to jump into the hair transplant with all the available grafts. I would say do somewhere in between, neither minimum graft, neither maximum. And then, one should do the second sitting after 6 months so that doctor is confident, you are confident, we know how your scalp performed, we know what is the quality of your hair and how did your body perform to the new grafts. Because the same number of grafts, same technique, results can differ depending on the quality of the hair, the quality of the scalp, and your physiological condition. So coming back to what constitutes a premium hair transplant. So premium hair transplant starts with, see, those who are seeking premium hair transplant, they never ask cost first. What they asked is who is the captain of the surgery? Who is under control? Remember, the cost of doing transplant depends nothing on the medicines or instruments. The instruments which are used like forceps, machine, this and that, no cost, even the best of best. Okay, the medicines, antibiotics, and all those used are no cost. That's peanuts. So the cost for a clinic or a surgery for actual instruments as well as medicines is not more than 10%. So please understand, even if the best of equipments are bought and even if best of medicines are used. So I'm telling you the insider story. What is inside? Because I'm sitting this side, okay? The cost really depends on the captain. Take for example the advocates. You will see so many new advocates, assistant to so many people, in the courts. But think about top lawyers in the Supreme Court, High Court. They may charge whatever they want. Okay, so similarly in the hair transplant industry, the expenditure of a clinic is nothing, not more than 10% for maybe forceps, the punches, the motion, micromotor machines, the GFCs, the PRF, the exosomes, and whatnot. It's all about the captain of the ship because the captain of the ship is what you're buying. So who is the boss? Who is the captain? Is he ethical? Is he honest? Is he expertised? Does he know his job well? Does he have thousands and hundreds and thousands of successful cases? Does he have no blot in his career? So it depends on the boss because if transplant becomes good, his image and brand improves. If the transplant results are bad, his image goes down. So you should buy the controller of the surgery, the captain of the surgery, the boss. Remember, because the boss decides. Now there could be three boss, three captains, equal in category or recurrent incompetence. But one may raise its price high because some people think महंगा है तो अच्छा है, expensive is good. The other may have medium price, and the third one may be more humane. He may think, why should I, be greedy so much? Because my patients are also 20 to 35-year-old young guys, they are working, you know. So why we should be too much greedy? So the third guy may be charging you less just because he's more ethical, he is more spiritual, he is more humane, he is less greedy. We are not against the other two doctors. They have a full right for the hard work they have done to charge anything they want. So don't always think expensive means better. First of all, you have to finalize these top three clinics which offers high quality transplants, perfect transplant, and then you decide among the three by speaking to all the three bosses. Now that's your research. Of course, if you call me, whether you do it from us or anybody else, I don't mind telling you you should do from this or this. Even if you don't do with us, no problem. That's not an issue. We need 500 surgeries a year. We are already booked for next 2 3 years. Okay. Sometimes there's a cancellation. Only then we are taking new patients. Otherwise, because of 15 years in this field, this clinic, so through word of mouth, 500 surgeries a month, a year is no big deal for us, okay? And also for the senior doctors. So let's come into so this is, I told you, few important points. Now let's come into the technicalities. Now that research you have to do, I can just explain about what we do here and what my friends do. Again, I'm telling you, please don't go to any unqualified clinics, not full safety. People have even died in a transplant in Turkey, in Spain, in America, in Pakistan, in India, and so many places. So this is unsafe places and this is the safe places. Remember. So no, don't ask for the cost first. At least come to a quality place where you are safe. Now somebody will say 5, 6, 7,000 grams they will do in one day, but whether they will come, whether they will look natural. So it's not about 5, 6,000 grams doing in a day versus doing in two breaks. So there's a quality difference. It's not somebody says 5, 7,000 grafts will be planted, so you'll be so happy that it will come. It should grow also, right? Now, let's come one by one. A little bit technical, how to choose to help you out. First and foremost, remember, prepare yourself for hair transplant. Majority of the people are not understanding this. This is very, very, very important. You may think of transplant after 3 months, 6 months, 1 year, no problem. Right now, you can WhatsApp your front photo, top photo, and back photo and send your photos, your age, your profession, your city. Are you applying something, taking something for your hair growth? Are you suffering from a medical condition like diabetes, BP, allergies, this, that, and all? Are you taking some medications? You're vegetarian, non-vegetarian. Okay. Are you highly stressed, normal stress, or you're cool? So we need some information. Then, under our guidance, under our team's guidance, the doctor is going to tell you whether you are a candidate for hair transplant or not right now. You may not be fit for hair transplant, or you may be fit later for a hair transplant, or you don't need a transplant. You're too young for a transplant. You may be just having a thinning hair. So we will guide you free of cost because that's a duty. Okay.